So to illustrate this opportunity, what I want to do is tell you the Connecticut story, our story in the evolution of the Help Me Grow program that Anne earlier introduced. And I want to try to do this in a way that it will hopefully derive implications for you, particularly given the efforts that you are about to embark on in Erie and Niagara counties. Lessons that we've had the privilege now, with support from the Commonwealth Fund, to travel around the country to at least 5 other states, share the lessons learned, and provide assistance as other states begin to replicate what we have done in Connecticut. So, our statewide program began with a citywide initiative in Hartford. Now, Hartford is the state capital of Connecticut. Connecticut, even in the most recent surveys, amazingly is still the state with the highest per capita income in the United States. I say amazingly because our status as number 1 is really driven by Fairfield County, our Gold Coast, and Wall Street. So the fact that we are still number 1, and I saw that in a recent survey, is amazing to me. And actually, I find it hard to believe, given that our state budget deficit, because of the losses that we anticipate from taxing the income in Fairfield County, has now ballooned to $8.7 billion in a state with 3.5 million people. So, Hartford, the capital of Connecticut, highest per capita income in the country. There has been a promotional effort to describe Hartford as New England's rising star, and it does have its lovely sections and parts. This is Bushnell Park. However, Hartford is also, at least in the surveys that we looked at, ranked the second poorest city in the country. And in fact, Connecticut plays host to 3 of the 10 poorest cities in the country: Hartford, Bridgeport, and New Haven. The discrepancy in quality of life between suburban and urban living is overwhelmingly a problem. Overwhelmingly a problem. And in this poor city, we face all the adverse impacts on children's development that you can well imagine. The one that I've chosen to cite here is lead paint, but I just as easily could have cited neighborhood violence, family violence, drug problems, etc. So it's within Hartford that we gathered together child health providers and other constituency groups. And in answering the question, how could we strengthen child health services to try to best promote Hartford's children's optimal, healthy development, we made some assumptions. And I'd invite you in your respective communities to think about the extent to which these assumptions apply. What I've certainly learned over my past 2 days in Buffalo is that these assumptions very likely do apply locally here. Number 1, we assumed that children with behavioral and developmental problems were escaping early detection. Well, we were not on thin ice in making this assumption at all. And in fact, one need only go into our kindergartens, first grades, second grades to appreciate the extent to which children with significant issues were escaping early detection. Secondly, we assumed that there did exist a wide array, even in poor urban Hartford, a wide array of programs and services that existed to address children's behavioral and developmental needs and support families in promoting children's optimal development and behavior. Of course, we knew that there are capacity issues. We knew that there are gaps in services. But we did believe that there were programs and services out there that could be brought to bear in addressing the needs of at-risk children. Third, we assumed, again, not a dangerous assumption at all, that a gap existed, between the best efforts of child health providers, child care providers, preschool teachers, visiting nurses, social workers, and others to promote the early detection of at-risk children and the linkage of these children and their families to programs and services. And finally, we made the assumption that children and their families in Hartford would benefit from a coordinated, region-wide system of early detection and intervention for children at behavioral and developmental risk. And it was on the basis of these assumptions that we brought together a host of partners. But from the outset, we realized that if this was just about early detection, and it didn't result in linking children and families to programs and services, then our early detection would certainly be ineffective in terms of promoting the best outcomes for children. And in fact, we agreed with Ellen Perrin, a colleague of ours in Boston, that such early detection without intervention is not only ineffective, but it's unethical, because all it does is further raise parent anxiety and concern without the promise of any assistance. So with these assumptions and with this belief, we brought together a host of partners. The specifics are not important for you, but I would point out that our collaborative included funding agencies, and indeed how important they are in providing support. And for us, the Hartford Foundation for Public Giving has been a very generous and very thoughtful both supporter as well as contributor to the evolution of our program. This was a public-private partnership, and we embraced our city health department and its child development program. We engaged every child health provider across the city, pediatrics, family medicine, physicians, mid-level practitioners. We embraced our information and referral system for our Medicaid managed care system, anticipating that telephone access would be important, our so-called Children's Health Info Line. We fully engaged parents in our planning process, and recognizing the relationships between the detection of children at risk and referrals to our statewide early intervention system, our Part C, which in Connecticut is called Birth to 3, we engaged our Part C colleagues very early as partners, even in our citywide pilot initiative.